and I'm here to talk to you guys about a breakthrough in technology. And this is a device called CellSound that we've been using at our practice for over a year now, and really is the future of regenerative aesthetics. You know, we all talk about regenerative aesthetics, and some people confuse it with biostimulators and whatnot. Just a show of hand here, who in their practice talks about regenerative aesthetics to their patients? Okay, and so you're probably using things like PRP or PRF. That's kind of the easy, low-hanging fruit. And regenerative aesthetics to me is something that's actually not inducing anything like a foreign substance, and really you doing something to the face, to the skin, to the body to stimulate one's own improvement of that environment. And there's a whole discussion about anti-aging and wellness and longevity, and it's actually become quite popular in Los Angeles, and I'm sure in your cities as well. We all want to live well, and we all want to live well as long as we can. And then people are also taking it to the extreme. We have these biohackers. Do you guys have any biohackers in your practice? So these are kind of like the 1% of the 1% of people that have these resources, and they go to Europe and they meet with these scientists and do all this anti-aging stuff. They plunge in like negative 50-degree baths, stuff that I just, I'm not there yet. So let me get into what CellSound is, and actually there's some interesting correlations with what Dr. Walker was just talking about in terms of dislodging emboli, and I'm going to show a case of vascular occlusion that was referred to us, which is also really interesting. So I'm going to review ultrasound technology because this technology is ultrasound combined with electrical field stimulation, and just kind of put us all in the same playing ground. So focused versus low intensity and non-focused ultrasound. I just want to define a few terms here so that we understand what we're talking about here. So non-focused ultrasound really is just that. It's an ultrasound that simply is going to penetrate the tissues, and then depending on the density of the tissue, you'll get different signals back. And we have terms to describe this, hypoechoic, anechoic, hyperechoic, and that just means how it looks on the ultrasound. Who here is actually utilizing ultrasound in their practices to any degree? Okay, Lee back there, of course. Okay, so yeah, and that's the point. Most people are not using ultrasound. Now places that are centers for reversing vascular accidents, vascular compromise, most people are utilizing ultrasound to some capacity, and that's why I really picked up the ultrasound. I don't think ultrasound in terms of guided injections is really practical, and it takes a lot of it's like aspiration, right? It's not going to really keep you safer. It's not going to keep you better. It may make you stop and think about what you're doing and to see the anatomy. I do think ultrasound is useful if you're trying to target like a nodule, or we did I took Leonie Schelke's course when she came out to Los Angeles, and one of the nurses had Voluma injected in her face, and we were doing ultrasound guidance because she just wanted to kind of remove it. It was so incredible. When we put the 27-gauge needle with the ultrasound, it actually bounced off of the nodule. And so imagine, and it was a Vicross technology. So imagine if I had just blindly gone in there and put some hyaluronidase and then said, oh gosh, it didn't work. And so those are the things that I think it's useful. Now, ultrasound, and those of you that have had children or have been with a partner that have had children, the obstetrician utilizes an ultrasound. And that's not making the fetus any younger or better, right? But that's really low energy, low intensity ultrasound. But once you start to increase the intensity, you will have an effect on tissues. Have you guys ever seen a video of someone singing so loud and so high that they could break a glass? So we know that sound waves can actually affect vibrational movements of tissue. And this actually has been really big in terms of physical therapy, sports therapy, physiatrists, orthopedics. When athletes or even regular people get injured or have inflammation of their muscles, of their fascia, you can utilize non-focused ultrasound. And that has been utilized for many, many years. But a recent meta-analysis looked at this non-focused ultrasound versus placebo, and placebo actually is pretty powerful. If I give you a pill, 20% of whatever you're suffering from is going to be better. And so we know that the placebo effect is important. And the reason why this is relevant is because what is the barrier to the tissues? Why is it not any better than placebo? So this is where researchers and scientists have been trying to figure out, like, how do we get ultrasound to surpass this placebo effect and have a real therapeutic effect? Because we know that when you start to vibrate tissues, you do have a positive effect. We know that we can increase blood flow, okay, which is going to have improvement of delivery of nutrients, oxygenation of the tissue. We can improve lymphatic drainage. Lymphatic drainage is an issue whether you have an injectable placed in your face or not. And we all know that some patients, when they have their mid-face and their under eyes injected, they look great walking out of your office, but then a month later, 2 months later, 3 months later, they have edema, malar edema, because we have obstructed some of those lymphatic outflow tracts. But we also know that when you vibrate certain tissues, like muscle tissue, you'll improve the muscle volume. You can build collagen and elastin by vibrating the tissue. And you can, if you vibrate a fat cell, you can get it to release its triglycerides. Well, that's interesting. And so these are all really kind of like fascinating things. So how do we harness this technology for our use? Well, here's the barrier. So the barrier is called impedance. So all of our tissue has natural electricity to it and electrical resistance to being vibrated or to being altered. And so non-focused ultrasound suffers from this limitation, because as soon as you start to perform the ultrasound, you vibrate the tissues, then the effect, you'll have that effect of all the things that I just explained in terms of improving oxygenation, blood flow, microcirculation, macrocirculation, etc. But then the tissue doesn't want to be, it stops being vibrated because of the impedance. So the breakthrough here is utilizing an electrical field around the ultrasound so that the therapeutic effect can continue throughout the duration of the treatment. So that's really the technological breakthrough here. And one of the things that really fascinated me by this, who here, by the way, was doing cool sculpting, sculpture, any of those fat loss types of machines? So we went through an era in the US and really worldwide where we just wanted to kill fat cells. We wanted to destroy tissues, and we're still killing cells. Anytime we use radio frequency, anytime we use these other modalities that go either under the skin, through the skin, we're destroying some cells. And sometimes it's a selective heat injury, like fractionated lasers, for example, fractionated ablative laser technology, fractionated radio frequency. And when we have learned how to do that to the point where we create just enough injury and then it repairs. But the paradigm shift now is like, why injure the tissue at all if we can have a technology that is going to allow the tissue to regenerate through sound waves? And now with this breakthrough of having electrical field stimulation around it, we can do that. So where's the proof? So most things that I look at, so when I first looked at PRF and now Easy Gel, I always look at the wound healing studies, because if something can heal a stagnant wound or a stalled wound, then there is going to be some beneficial effect in terms of aesthetics and improving the face and the body. So this technology actually has been utilized and is utilized in many, many hospitals for wounds, combining electrical field stimulation with the ultrasound. They call it CUSEFS. And this is really where it's at. So you can see here, so this is a stagnant chronic wound. So this wound did not respond to all the traditional measures. And then after 8 weeks, you can see that the body has now been able to regenerate. And this is typically in diabetics, people that have circulatory issues and circulatory compromise. So we got this patient referred to us. Okay, so let me show you here. And Dr. Walker showed some examples of this. So this is a nurse who had 0.3 cc's of Radiesse injected into her left nasolabial fold. And she had this really bad pattern of occlusion. She actually was wearing makeup, but she had this ischemia, really focused where the ejection occurred, up into her forehead, nose, hard palate, lip, and even her chin. Okay? So now she didn't lose her vision. And Dr. Walker just gave me a brilliant and beautiful description as to probably why, because she probably had a choke going back to her eye. And there's also some data coming out about only about 1 in 1,000 of us have retrograde flow from the branches of the external carotid into the internal carotid. So it's like a double hit, it's like getting struck by lightning twice. She got struck by lightning once, but she probably didn't lose her vision because she had strong flow going in her favorable direction behind her eye. But still a big, really bad problem. And we've seen the natural progression of, especially radiesse, which is not a dissolvable material, but there are some people that believe that hyaluronidase should still be part of the treatment algorithm because the carrier, the carboxyl methylcellulose carrier, might have some beneficial effect. So what did we do? So I basically, and by the way, she came to me 4 days after the injury. She had messaged her physician, the injector, saying that something's not right. And her physician injector said, "Oh, you're just being hysterical, histrionic, it's fine." And then she reached out to me, the physician who did the injection reached out to me 4 days later and said, "Hey, I don't know if my patient is just being a crazy loon job or whatnot." I was like, "Send me a picture." Send me a picture, and I about threw up. I was like, "Have her come to my office right now," okay? And this is a radiesse occlusion. So what did we do? So one of Dr. Walker's points about dislodging the embolus. Okay, so she had an embolus of calcium hydroxylapatite. So I was discussing this with Natalia Guzman, who's a nurse practitioner and superstar and educator in my practice. And she was like, "Why don't we use CellSound in addition to all the other things that we want to do? PRF, just to help restore the environment." I did do ultrasound-guided Hylenex. I knew I wasn't going to dissolve radiesse with Hylenex, but I thought, maybe if I can get some improvement of vascularity, then we can help. And what's amazing is that within 2 weeks, I think I have a video here. So you can see her progression of the necrosis, and then you can see the skin sloughing and the epidermal lysis, and this is just all the progression here. But utilizing when we did her first CellSound treatment, she said her pain went away, which was a really good sign. And she said that my face feels better because I'm not in pain anymore. And that to me was like, I don't have proof of that, but that we had started to dislodge some of the emboli that were choking off her angiosomes, her facial angiosomes. And then within 2 weeks, her smile had returned. She was able to go back to work. Now she's going to probably have some hyperpigmentation and some skin issues, but and look at her smile. So this is really typical. We've knocked out her ability to smile, probably from the levators of the lip here being affected because you have a full thickness injury here. And so here you can see the progression with CellSound and with PRF to restore her smile. So again, this is the therapeutic and maybe non-sexy part of this. How do we convert this into utilizing CellSound for day to day? But I'm always fascinated by anything that can help us rescue a disaster or save a disaster. And I'm not saying that CellSound should be part of a vascular occlusion or a blindness protocol yet, but it's something that may eventually be useful. So let's talk a little bit about focus ultrasound before I go back into CellSound. Who here has heard of all therapy or HIFU, high intensity focus ultrasound? So high intensity focus ultrasound was considered a breakthrough when it came out, and it's still popular, not so much in the US anymore, but still worldwide. People are using HIFU. Well, this again is using ultrasound, but really cranking it up. But the problem is that we're just going back to the same issue I told you about in terms of damaging cells and injuring tissue, and then depending on that tissue to repair itself. And now, unfortunately, you have this whole subset of people and patients that have had volume loss, facial atrophy, scarring of the muscle. When I do a deep plane facelift on a patient, I ask them about their history. When they tell me that they've had HIFU, I know I'm in trouble in terms of the scarring under the SMAS. Because when someone has had a lot of HIFU to their treatment, because it was going down to the SMAS level, it's hard for me to go in the deep plane safely. I mean, I do it, and I'm an experienced facelift surgeon, but it definitely does make the operation trickier. I book more time for those patients, and I'm really careful with the dissection, because usually when you get in the deep plane, it's just a beautiful, nice plane, except for when you have to release the ligaments, it gets a little bit dicey there. So that's the issue with focus ultrasound, and that's why I think all therapy now, and again, nothing against all therapy, but I think as a technology, it really is not ideal. Now, the patients, if you looked at the patients that responded well to things like HIFU, they were younger, they had volume to lose, they were in their 30s, and they did enjoy some tightening and loss of tissue, but then what's going to happen to that face in 10 years, in 20 years? It's probably not going to go well. So just want to really contrast, because when you think about ultrasound, a lot of people think about HIFU. This is not HIFU, okay? This is not HIFU. So this is actually something I did in my office, because when I was learning about CellSound, they said, it can penetrate to 10 centimeters. 10 centimeters, that's very, very deep. So I set it up this is just dyed soap, and that's the CellSound probe. And this is really, if you could think about this happening in the vessels, in the tissues, of the ultrasound vibrating the tissue, but at frequencies and at energies that are not going to destroy tissues. And that's really the key. So when we're able to go 10 centimeters in depth, we're able to get past the subcutaneous fat layer. So if we're treating someone's abdomen, for example, 10 centimeters, that's down to visceral fat. That's quite deep. In the face, we don't treat that deep. We can go as superficial as the skin, or we can go 2 to 3 centimeters deep in the face and in the neck. But in the body, 10 centimeters is quite significant. So here's where it gets exciting. So let me go back here. So if we can go 10 centimeters in depth, and we can vibrate and put the adipocyte into resonance and all the tissue around the adipocyte in resonance, what happens is that as the adipocyte starts to get vibrated, then the proteins are able to come into the adipocyte and take the triglycerides out. So you're sucking the triglyceride out of the fat cell while maintaining the integrity of the fat cell. So we're not destroying the adipocyte. So now, because once you destroy an adipocyte, the immune cells come around and say, there's been injury here, so it's going to create fibrosis. It's going to create scar tissue. But if you're not destroying the fat cell, then you really have something there. And also, what is really interesting and was shown in this study from Dover is that we all use different types of materials for energy. We use fat, we use carbohydrates. After the CellSound treatment, the lipids became the primary energy source. So that's really fascinating, because now we are not just disrupting the membrane of the adipocyte and the lipids are coming out, they're being used as energy selectively in our hepatic system. So that's actually really cool, because we can all stop working out. Just kidding. That's not true. Still no shortcuts to working out. But here from the study, and this was a predecessor device, but it's essentially the same technology, that a single treatment increased the percentage of fat used as energy source, just like in moderate intensity exercise, by 52%. So that's, again, really fascinating. So when they did the treatment, energy is great, but they saw immediate reduction of circumferential girth and distance of the abdominal region. And when I heard this, I said, I don't believe it. I don't believe it. This sounds like BS. There's no way. So the CellSound team, SD and Mark, came to my office, with one of the early devices. They're like, you know what? Let's see. You're claiming I'm going to see results right away? All right, let's see. So we treated our staff, and and there's a photo system with it, right? Because like I'm really into objective data. You know, I'm tired of seeing the before and afters where the after is like really well lit and smiling and the head up. You know, I don't buy any of that. And so I said, okay, we're gonna weigh everybody. We're gonna do measurements. This is before we were using 3D photography, which we're doing now in our upcoming studies. But you'll see, I'll show you the pictures. There's transverse measurements of the areas being treated. And we were blown away. So some of our staff scrubs weren't fitting them. They were like looser. And we did the whole series. We did 2 treatments a week for 3 weeks. And it was easy because, the staff were like, oh gosh, like what is this treatment you want to trial on us? It didn't hurt. It doesn't hurt, which is actually very atypical for a lot of the treatments that we are doing now. Some of the radiofrequency microneedling is literally like human torture. I mean, have you guys done that? And you have to do Pronox and an hour of numbing and blah, blah, blah. So it didn't hurt. It feels like a warm massage. And then on the face, and I have some videos of this, it just kind of feels like you will feel some contraction of the face and the muscles while you're having it done. It didn't hurt, and there's no downtime. So I was like, this is just, this sounds too good to be true. And so then I said, okay, there's something here. And so we started utilizing it first for the body. And then I came on board to really help develop protocols for the face. Because again, I'm a face guy. I love everything related to the face. And now we're kind of almost a little over a year into it and have some really exciting uses for it. I figured by this point you'd be tired of hearing my voice. So lovely nurse Natalia, you're going to hear a little bit from her now. Can we have the volume up, please?
Invasive treatment now easier, faster, and safer than ever before. Using highly innovative and advanced non-invasive ultrasound technology. The treatment uses low-power ultrasound resonance technology to remove unwanted fat. An ultrasound beam selectively targets fat cells and brings them to a state of natural resonance. The resonance effect triggers the cell's release of their fatty substance into the tissue. When the fat is broken down into lipids, it is recognized by our body as free fat, which is then carried to our blood and cardiovascular system to our liver, where it is transformed into energy. The focused ultrasound energy targets fat tissue and does not affect the surrounding blood vessels, nerves, and connecting tissue. The treatment is based on the body's own natural biological process. The treatment, generating a sensation like a warm massage, is painless and is considered pleasant by most clients.
So as you can see, there's no numbing cream was applied. The treatment takes anywhere from 30 to 40 minutes on the body areas, and then some of the facial areas, it just depends if you're doing face and neck, anywhere from 20 minutes to 30 minutes, 40 minutes, etc. So that's really what the treatment time is. And so, let's see, it went forward. Okay, so how are we utilizing this now in our practice? And now there are actually several practices around the country that are utilizing CellSound for their patients. So this is the patient, again, who is seeking regenerative therapies. We're utilizing ultrasound with electrical field stimulation to help them regenerate their own tissue. And there's a couple different novel uses. We can reduce fat by, again, setting with the larger handpiece and then going down to 10 centimeters. Or in the face, we can improve the skin tightness. We can improve the skin quality, the environment. And CellSound can be used as a standalone, and of course it could be used in combination with all the other things that you're doing with regards to biostimulators, PRF, hyaluronic acid fillers, threads, etc. So let's look at some examples now. So when the CellSound first came out, I said, what can this do in the face and in the neck? So this is a patient who went the whole treatment therapy, so two treatments a week for 3 weeks consecutive. Now some people say, oh gosh, I can't get a patient in that frequently. You can space it out more than that, but that's the recommended full treatment. And I want to draw your attention to her neck. Necks are really, really hard to treat. When I do a face and neck lift, I'm not improving the quality of the skin at all. I'm stretching it, I'm pulling it back. And for a while, it looks good. And after 3 months, they said, Doc, I still have crepey skin. Did your neck lift fail? Well, no, my conversation with expectation management failed. because I didn't really do anything to improve the quality of the neck. And seeing this, and this is only CellSound, and imagine how hard it is to tell a patient you can't do anything else for a while, because we really wanted to just have no confounding variables to improve the quality of the skin. Now we're doing volumetric mapping. This is called Vectra markerless tracking, to look at the changes of the of the tissue. And what we're noticing is that the tissue is kind of moving into like a lifting direction. And so, again, I wouldn't tell a patient, oh, you're going to have like a facelift result or whatnot, but the patients say, my gosh, I look better, and I can't exactly put my finger on it as to why. And because we're improving and we're increasing all of their circulatory environments. And we have now loads and loads of photos like this of patients before and after, showing the different volumetric changes that are happening on the face. Here are some of the things they can do in the body. So these are some of our advisory board colleagues. This is from Dr. Nikolov, showing improvement again of the skin quality and overall reduction of fat. And again, when you look at these, for a treatment that does not destroy cells, it's pretty impressive. And the patient satisfaction has just been through the roof. Something that doesn't hurt, that they have no downtime for, and will get them results. And that's why CellSound has been so popular for us. This is a patient who actually only went through half of the treatment, 3 treatments here, and you can see the improvement there. This is what I like about CellSound, and this is one of the things that kind of drew me, is that they were very, numbers based. Okay, so the proof is in the numbers. Yes, the patient has to perceive a result too. But it's not just like, a before and after. It's objective data measurement that really is a proof in terms of how this technology works. And so when you purchase the device, it comes with this camera, and I'm pretty sure they'll have it here so you can see it. It's like a green screen background, and then it'll give you these measurements, and then you can see after this patient's treatments, you have a reduction of 4 centimeters, 3 centimeters, 4 centimeters. We were in Aspen at a meeting, and one of the dermatologists, dermatologists are hard to convince of anything, and he was like, "This is BS, doc. I'm sorry. Like, I don't buy it." We're like, "Doc, we invite you for a treatment, like at lunchtime," and luckily this dermatologist had a lot of target, so we did his measurements, and he lost 10 centimeters at lunch. So he was convinced. But that's, it's kind of a funny thing. And it's good to challenge. We should always be challenging anything you hear from anyone, no matter who they are, what they are. That's how we all learn and advance together. And I'm going to challenge everything Dr. Walker said these last 3 days. And so here you can see some other measurements, changes, 58.5 to 54. And the patients really, their clothes fit looser. It's not just about millimeters of change, centimeters of change. They really see a difference here. And you can see a 10 centimeter reduction here, 10 centimeters. So this is a much bigger result. And the more target you have, of course, when you're treating the adipocyte, then the more reduction that you're going to see. So that is, just makes sense. Here you can see a patient of Dr. Gilbert Lee's, a plastic surgeon in Southern California, and you see really nice reduction of the flank fat there. This was one of our staff that we treated, Nurse Natalia, treated her, and it looks, she just had a little bit of excess there. In LA, we consider this morbidly obese, and so it was almost an emergency procedure for her, and so that's why we're all on Ozempic. So you can see a nice result there. You can treat the gluteal region. You can treat thighs. This is another abdominal. These are some of the international experience. Of course, why did the international people always get stuff before us? Why? It's just not fair. We're America, all right? America first. Well, I heard the great news that Dr. Walker is expatriating from the UK and will be moving to the United States next year. So we're going to hopefully be seeing his pretty face at a lot more conferences in our country. Here are some other international results. Arms. Actually, this works really well for arms. Natalia treated one of her sisters, and that's always been her big problem area. She hated wearing short sleeve shirts and dresses just because she's not overweight, but her arms just had a little excess there. And the areas you can see some skin improvement there. So this actually is impressive because people say, okay, well, is this a fat machine? Is this a skin machine? Like, what is this? It's customizable. So you can customize it to treat superficially to the skin. You can go a little bit deeper. So you have to just think about the area. This patient, I wouldn't say has a lot of extra fat there. They have a skin issue. They might be thinking about an abdominoplasty or a tummy tuck procedure. But in this country and really worldwide, only a very small fraction of people will go through a surgery. That's the same thing for facelifts, for body surgery. That's why the minimally invasive and the non-invasive space is so popular, because people don't want the downtime, the risks, the cost, etc. So we've been really excited about this technology, and in terms of a true regenerative energy-based device, if that's what you want to call it, this represents a breakthrough. Not many people have heard of it yet, but as we have come into different practices around the country, the enthusiasm has been very, very high for it. So you'll be hearing about it more and more, and then you can say you heard it here first. Thank you guys so much. Yeah. Yes, so actually that's a great question, and so the question, I'll repeat it, is there any concern about lipid release into patients that have high cholesterol? And we actually talked about this amongst the advisory board. If a patient has really high cholesterol and maybe at risk for MI or stroke, or they have some clotting there, then you may want to get labs and have that patient evaluated. Right now, we haven't seen any issues like that, but again, with an emerging technology, we would always recommend treading more carefully before we can say, oh, it's not a problem, and so and we are doing some we're going to be doing some lipid measurements as well, just to see how long the lipids are higher detected in the blood and whatnot. So that's a really great question. You're allowed one question. No. Yes. What about targeting fat pads like and also what about you guys are smart. So I didn't have time to get into it, but there's different hand pieces for the face. So the one called Define actually can target facial fat pads to reduce them, to shrink them. So we've used that for someone that has excess buccal fat compartment. So basically, yes, we're reducing those facial fat compartments, but selectively, and we're not destroying those cells, so that patient doesn't have facial atrophy down the road. But yes, you can actually use a different handpiece to do exactly what you just said. Smart cookie. Any other questions? Hey, Dr. Nikolov. I was just talking about you. Yeah, actually, that's a good point. And so, basic question is, well, how long does it last? When do patients need to have retreatment? So we've seen now, after we've done a series of treatments, anywhere from 9 to 18 months results. Now, when a lot of patients, we'll do a treatment and they said, "Wow, can we get better? Can we get better?" So we're trying to figure out exactly what that algorithm looks like. After the treatments are done, I'll typically say, okay, why don't you come back in 6 months, and then we'll take a look and see whether or not we want to do another series. Because there's always going to be some endpoint, especially for skin tightening. But in terms of improving the vascular environment, I could definitely see this as being like a maintenance type of therapy, just to keep the circulation and the environment youthful. Nick, did you have anything to say about that? Right.
That's kind of the recommended regimen. Sometimes, for those of you that do liposuction, just because
And Dr. Nikolov actually, myself and other physicians on the advisory board are about to launch actually a prospective multi-center trial, and we've actually partnered with Quantificare so that we can show exactly what is happening with facial volume changes, skin quality, and we're going to be doing the face and the body. So we'll have a lot more data to show you guys in terms of, because now that we've kind of improved the technologies and the protocols and figuring it out together, I think this is just the tip of the iceberg of what this technology can do. So the question is, will this have an effect on HA and on calcium hydroxyapatite? So I showed you in the acute setting, when you had an embolus, we wanted to disrupt that embolus. And now when we do have a vascular occlusion, in addition to all the protocols that showed you, I am actually incorporating CellSound into that to, again, try to disrupt that embolus. In terms of someone that's had an elective aesthetic treatment, again, I don't think we could tell you for certain whether it does or not. It probably depends on when that filler or product was injected, where it is in terms of its status. If it's something that you don't want to dissolve, you can simply just change the settings to not go over that area as much or as deep if you want to just focus on the skin quality over that area. Awesome, guys. Well, thank you guys very much for letting me come and talk with you, and hope to see you all soon. Thanks.
Ladies and gentlemen, please